Insight on the coronavirus outbreak, we turn to infectious disease and pandemic preparedness expert at Johns Hopkins University Center for Health Security, Dr. Amesh Adalja. And Doctor, I guess the scariest thing, at least when you read through these cases, is that we still don't really know how the coronavirus is transmitted.
I think it's become very clear now that this is transmitting efficiently from human to humans as a respiratory virus, almost similar to what influenza does. And that really changes how we approach this virus, because there's different measures you take when this is an animal to human transmission versus a human to human transmission, and it becomes very challenging to control.
Yeah, and that's the question is how common is that human-to-human transmission? I mean, we were just a few days ago, people were saying, well, you know, animals, like Lauren was talking about, animals to humans might be it. It's human to human. We know about the case in Illinois where the wife apparently transmitted to her husband. How much do we know about the disease itself?
We do know that it's transmitting efficiently from human to human in China, and we have seen some limited transmission in other countries. For example, in Germany, they have multiple generations of cases. We've seen healthcare workers get infected in France. So we do know that this can transmit, and that kind of changes from what we were saying earlier, because we learned more about this virus having this capacity to efficiently transmit from human to humans, and that makes it very daunting to try and interrupt those chains of transmission, because everybody breathes, everybody coughs, everybody sneezes, and we're in the middle of flu season.
What do you make of the response to this, Doctor? I mean, are we doing enough? Is it appropriate? Is it not enough? I mean, we talk about the flu killing between 12,000 and 50,000 people a year in this country, and there's no national emergency about the flu. So far, this hasn't killed anybody in the United States, and yet there is now this health emergency. Is it being handled appropriately in your estimation?
That's an important question, and I do think that the declaration of the public health emergency, which is going to mobilize HHS and CDC and other organizations to try and divert resources to controlling this outbreak and mitigating it and preparing our healthcare system, that is very important. I do not think that the travel bans are warranted. I do not think that the quarantines are warranted. I do think we need to monitor and screen people as they come in and educate them about the symptoms, but this is going to end up being a community-transmitted virus, and the severity is not going to be what we were seeing in China. It's going to fall substantially. As we understand, there are more asymptomatic cases, there are more cases with very mild symptoms, and it's really only a small number that are going to get severe disease or require hospitalization or ICU care or even die, and I think that will change the risk perception of this virus as time goes on.
But if you talk to some of these medical experts who do support the travel ban, what their contention is, Doctor, is that they're afraid that as this coronavirus makes its way into countries that do not have as robust a healthcare system as we do, that it could spread very rapidly, and it's not going to be treated well, and that death toll will be high, and that those people could then end up coming in this country in high numbers. What do you make about that argument?
It definitely is true that the resiliency of a healthcare system is going to impact how well they deal with this. But the point is, we've got likely asymptomatic transmission before symptoms occur. We've got respiratory virus that spreads through coughs and sneezes. We know that this was probably spreading in China for probably 2 to 4 weeks, at least before it was announced, and people traveled already. So there likely are mild cases that aren't being tested all over the world. We're really testing people that have strict criteria, not the asymptomatic. So it's probably much more widespread than you actually know about even today.
What do you make of the fact that the 8 cases now in the United States, the people who have the coronavirus appear to be doing pretty well in the scheme of things? And then you hear about China, where now the death toll has risen. I think it's at 270 plus now. What do you make of the difference in how the virus is being handled by different people?
I think that with coronaviruses, you have this spectrum of illness. Some people have very mild illness, some people have severe illness. And the fact that you have this number of deaths in China really speaks to the fact that this must be very, very, very widespread, because the mortality rate is going to be likely well less than 1%. So that means that there is a huge sea of people with mild infection that aren't being diagnosed or tested in China. And what we're seeing in the United States is probably more representative of what this disease is like, that it causes mild illness, pneumonia in some individuals, and doesn't even require hospitalization in many. And I think that will be the story that we'll tell about this virus, but it's going to take some time for all that data to be analyzed and to get the full picture, but that's what it's looking like to me.
Dr. Amesh Adalja, great insight, sir. Thank you so much.
Thanks for having me.